Welcome to Healthy Living, brought to you by Novant Health. I'm Robyn Zimmerman. Novant Health is dedicated to providing our local community and visitors with compassionate, quality, extraordinary care close to home. Let's begin our program with a few health headlines. Medical Laboratory Professionals Week, April the 14th through the 20th, is an annual celebration of medical laboratory professionals and pathologists who play a vital role in healthcare and patient advocacy. Novant Health is celebrating their remarkable laboratory teams during the week. And Novant Health is proud to be the official medical provider of the 2024 RBC Heritage presented by Boeing, April the 15th through the 21st. As the official healthcare provider, Novant Health clinical staff will provide first aid support for tournament spectators, golfers, and other guests on the grounds at the event. There will be a medical trailer located at the tournament entrance and will also be showcasing hospital services near Heritage Lawn. Stop by their expo at the Heritage Lawn for a chance to win a prize and learn more about their remarkable care. Now, while golf is relatively a safe and low-impact sport, it's important to follow a few practical tips to avoid injuries that can keep you off the course. Dr. Robert Hoffman, an orthopedic surgeon at Chatham Orthopedic Associates, offers the following recommendations for ensuring you enjoy the golf season ahead without pain or injury. Number one, don't overdo it. A good golf swing looks effortless, but in reality it engages a number of muscles: the trapezius and rotator cuff in the shoulders, the obliques in the abdomen, and the hamstrings in the back of the thighs, and muscles in the back. All these muscles are susceptible to injury if you work them too hard without periods of recovery. Hoffman said he recommends golfers practice conditioning, which means starting slowly and gradually increasing the activity over time. Rest is equally important, and an orthopedic doctor can help determine the best routine to help avoid pain. This may include prescription medications, injections, and/or physical therapy. And number two, properly warm up. An important part of avoiding golf injuries is establishing an easy go-to warm-up routine to help prepare the muscles for activity. A good golf warm-up takes only a few minutes and doesn't require really any equipment. It's key to focus on the areas of the body that rotate during a golf swing. So standing warm-up movements to include are trunk rotations, hip stretches, and body weight squats. And number three, don't ignore pain. If you do experience pain, don't play through it. Take time to rest before going back to the course. Hoffman said in about 80% of the cases, initial painful symptoms can be resolved in less than a week with rest, ice, and over-the-counter pain remedies like Tylenol and ibuprofen. Now, a symptom that warrants a trip to your primary care clinician right away is pain that goes beyond the nagging level and interferes with your daily life or nightly sleep. On the system's website, novanthealth.org, you can find a physician and more information on Novant's programs and services. Coming up after the break, we will continue with this edition of Healthy Living with interviews from Novant's physicians and staff. Don't go away.